Hey, everybody. We're just opening the room a little early to see if we can get some people in here, and we'll stay as on time as we can. So thanks for joining.
Welcome, everybody. The room's filling up. This is great.
Still got people coming in. Give another minute or so, Allison, before we kick off.
You bet. Thanks, everybody who's joined so far. We'll get started in a minute or so. Give it 30 more seconds. Chrissy, you good? And then we'll get started.
Yeah, let's do it.
All right, everyone. There's likely still more people yet to join, but I think we'll get started. We've got a action-packed hour to get through. So we're going to jump right into things. So hello, everybody, and welcome this evening to CPA's 2025 Election Mobilization Webinar. I'm Allison Steeney, the CPA Board President, joining you today along with the CPA CEO, Chrissy Bell, and Kayla Scott, the CPA Senior Director of Advocacy. I want to extend a very warm welcome to everyone for joining us this evening. Now, before we begin, I'd like to take a moment to respectfully acknowledge the land from which I'm speaking to you from. Now, despite there being a massive April snowstorm happening out there, I'm very proud and usually grateful to be joining you from Saskatoon, Saskatchewan, which is recognized as Treaty 6 territory, the homeland of multiple diverse Indigenous communities and cultures, as well as homeland of Métis Nation. Chrissy, if you could share where you're coming from tonight.
Yeah, I'm joining this evening from the region of the CPA's headquarters located in Ottawa, Ontario. And this is the land that is the unceded territory of the Algonquin and Anishinaabe people.
Thanks, Chrissy. So on behalf of the profession, we recognize and honor the enduring presence, resilience, and contributions of Indigenous nations and their ancestors to the land that we all call Canada. We, as physiotherapy professionals, acknowledge the complex history of colonization, displacement, and marginalization that Indigenous communities have faced, including the impacts of residential schools, forced assimilation policies, and ongoing challenges stemming from systemic injustices. We are committed to promoting reconciliation, understanding, and respect for Indigenous rights and sovereignty. We recognize that reconciliation is an ongoing journey, and we affirm our commitment to learning, listening, and actively engaging with Indigenous communities. By acknowledging the past, embracing the present, and working towards a more inclusive future, we strive to build meaningful relationships based on mutual respect, collaboration, and a shared responsibility. I also acknowledge that many of you will be joining us from different territories across this country, each with its own rich histories and cultures. I encourage each of you to reflect on your own relationship with the land and to learn more about the cultures and histories of the Indigenous peoples of your region and to contribute to a collective effort of reconciliation and healing. If you're unsure, if you want to learn more, a good reference is www.whosland.land/en. We'll add the link in the chat for anyone who's interested to take a look at that. I'll now ask and invite all of you to take a moment to reflect on the lands from which you are joining us today, and feel free to add that to the chat if you like. Thanks, everyone. Now, again, a really warm thank you to everyone who's joining this call this evening. I really appreciate everybody taking time out of your busy schedule to join us for this discussion. It's a very special moment when our profession and champions of physiotherapy can come together to speak about why political participation and using your voice during this campaign period is critical. Our goal this evening is to encourage your political participation in this upcoming federal election. This is going to be a fast and furious campaign period. As a non-partisan organization, we want to share the federal election materials that we've made available for the profession. We will provide an overview, key messages, and tools you're welcome to use in the coming weeks. We have a thoughtful overview of the federal election to go through as well. We have a thoughtful overview of the federal election and we'll go through our materials. We'll also look forward to hearing your questions and welcoming any discussion. We'll do our best to answer as many questions as possible. We do hope that you'll make the session interactive by using the polling questions when they arise in the presentation and the Q&A widget to submit questions in the chat function for meaningful and respectful discourse with one another. To participate in the Q&A session this evening, click the Q&A function box to submit a question or to upvote questions that others have submitted. Finally, and before we begin, I'd like to remind all participants that this webinar will be recorded and will be made available on our website. Another reminder that, of course, this is a professional forum which is designed to support the community during the federal election campaign period. While we recognize that there may be many diverse opinions regarding the subjects we discuss, we want to ensure that the space remains safe for everyone, and so we would ask that all participants maintain a respectful tone throughout the conversation. There will be discussion time set aside following the slide deck presentation, and we welcome your questions. The Q&A will be available during the webinar, so we welcome you to submit your questions and we'll do our very best to respond. Now I'm going to pass it over to Chrissy, who's going to start us off.
Yeah, thanks so much, Allison, and thanks to everyone who's here. You guys are going to notice me look left. It's because that's where the chat and the Q&A and all of the attendee lists are there, and it's nice to see a really great big list of people and a lot of names I know and some names that I don't joining us for our webinar today. The federal election offers a really amazing opportunity to show how strong our collective voices can be. And when we work together to advance the profession and increase visibility for physiotherapists, everybody wins. So before we start, I would be remiss if I did not thank our division and assembly members for their feedback. We worked with them this past fall, and I know Kayla got a chance to chat with the division chairs committee, and they highlighted their interest in putting Allison and I on a podcast, and we said absolutely not. But we're happy to do a webinar. So poor Tiffany, who I know is registered, I don't know if she's here yet, did a podcast with me recently and with Arthur, and Arthur and I talked so much that I'm sure she had hours of editing to do. So we thought this would be an easier format, but really appreciate the engagement and the support of all of the volunteers through CPA who said, hey, we really want to be engaged. We want to understand what's happening, and we want to understand how we can be part of mobilizing physiotherapy. So what are we going to do today? Honestly, for anybody on the list who knows me, I like to talk, and I'm going to really try to rein myself in to not going through this deck for an hour. I want you guys to understand our position, understand the landscape, set some context up a little bit, and then really want you guys to engage with us either in the chat or in the question and answer function. So we'll dig into some of this content, the election messages, why it's important to mobilize. We'll hear from our National Students Assembly, who are really glad it's here, and then we'll really open the floor and we'll dig into it. So first up, we want to know who's here. So Roxanne, if we could launch the first poll, just wanted to understand who's in the room. So which of these, you can actually answer both questions. We're looking for who's on today's webinar and where you're joining us from. And I cannot see if answers are coming in, so I'm gonna hope that Roxanne will wave at me and say, yeah, it's working. It is working, great. Amazing. And am I also gonna see the results of that poll, Roxanne? Let me know when we have a good crew of people in there and we can pop some results up.
Yeah, people are starting to answer.
Great. I'm assuming there's a place I can see that. There is, polls. Amazing. So it's really good and useful. I can't see the results. Kayla, can you see the results anywhere? Roxanne, is there a way I can see the results of the poll?
You should be able to see it right after I end the poll.
Sure. Can we close that up then? And we'll take a look at who is with us.
Sounds good.
Amazing. So as probably we should expect, most of our attendees here are physiotherapists. Love to see that we have a physiotherapy assistant with us, some students and researchers, other health professionals and administrators. And we have a heavy Ontario presence. We love to see some maritime representation and the West Coast as well. So we just welcome everyone across the country and in all of your various roles in physiotherapy. Thank you for adding to a very important dialogue. All right, federal election. So if you haven't heard, there's been an election called, a federal election called. This is the 44th Parliament that has recently dissolved, and we are heading into our 45th general election in Canada. The upcoming election is going to be held April 28th. This is a very, very quick election window of only 32 days of campaigning. So it is going to be a fierce race for voter support. The election writs have been issued for 343 ridings, which is 5 more than previous. And all of those ridings will have MPs now. I'm sure you see signs in your neighborhood and people campaigning on the news and elsewhere. Over the coming days and weeks, several political parties will unveil their platforms. They'll outline policy proposals. They'll start to engage voters. They might door knock. They might host town halls. And they'll be really working in their ridings to meet with voters, participate in public events, media appearances, all of those pieces. What does this mean for the government? Right now, the government is in what we call the caretaker period, which means they don't advance anything but routine governance, while the entirety of the country is really focused on the election. The next government we're thinking will be sworn in by as early as May 12th. But until then, there's a lot that we can do for the physiotherapy profession as we lead up to that election and in influencing the future policy and the impact that it has on critical care for Canadians. Couple of quick hit dates. The candidate lists are being finalized by April 9th, so you should know who is eligible to be voted for in your riding by then. There is on-campus voting for our student attendees, April 13th to 16th. The mail-in deadline is April 22nd. Advanced voting is April 18th to 21st, and election day is April 28th. So all very, very soon, which means that the MPs who are currently sitting incumbents, as well as any candidates for any riding, are going to be actively soliciting in the next several months, because there are people voting in as soon as just a few weeks, 2-3 weeks. All that's the boring stuff. Hey, there's an election. I think we all kind of knew that coming into this. Why does this matter? Why should we as a profession do something about this? And knowing what we know about Canadians and what they want and what they value and the critical offering that physiotherapy provides, we believe that using this election to mobilize for physiotherapy is absolutely critical. We're at this moment of change. It feels like the profession is really evolving at like a light speed pace right now. We've never seen this much momentum for physiotherapy across the healthcare landscape. We're not only a sought-after solution to challenges across the healthcare system, but we are now seen as a leader and authority within the health sector and a necessary participant in the key discussions influencing healthcare in the country. Frequently at the CPA now, we're having Health Canada, different MPs, different ministries, not just health, reach out to us asking for us to sit at tables, provide solutions, and influence the innovation of healthcare in Canada. And that's a really wonderful position to be in. And given that we're in that position, there's this awesome moment for us to align and mobilize collectively. Every day right now, our governments are becoming more interested in understanding the profession, seeking our opinion, procuring consultation. We just saw a physiotherapist elevated to the National Seniors Council. There are all these opportunities for us to collaborate on strategies for the future of healthcare, and being mobilized, being in an MP space, being in a candidate space, and sharing with them the important role that physiotherapists supply becomes a part of their context when they get into policy-making positions. I think we as a profession are really team-based. We are humble, we'll call it, and it's wonderful. It's a wonderful part of care for physiotherapists. But what we can't forget is that we are highly skilled primary care providers. Whether you are a physiotherapist or an assistant supporting a physiotherapist or a technologist in Quebec or a student hoping to come into the profession, you have a role to play in helping Canada's healthcare system. And we know that we can save this system billions of dollars a year if utilized effectively. You serve patients in emergency rooms, primary care teams, community clinics, in their home, in your own practices, and you're the next generation of healthcare providers if you're a student. So it is really important that our voice is heard from those people that get elected and write policy. Over the last couple of years, CPA has been really focused on building and driving relationships with government, ministries, all parties, all decision makers. Our messaging has started really, really granular. Just, hey, we're physiotherapy. We haven't been in the advocacy space too long, and we really want to understand what your position is and understand what you're trying to do with healthcare. To now, our message really starting to mature. We've taken a very strong evidence-informed approach, and we've let the priorities of the government and the dialogue of the government guide us to where we think physiotherapy should be sitting at tables and mobilizing within an evolving healthcare system. And that collaborative engagement, whether it's consultation with our branches, our members, our volunteers in the divisions, or students, it's really helped enable strategic messaging that's influenced policy. We're leveraging advocacy with physiotherapy evidence on a regular basis. We, as the CPA, have a collective voice and strong evidence about the value proposition of physiotherapy. The huge benefit here is when you're a CPA member, you're a CPA member and you're a branch member. And we work really closely together to understand how we can mobilize and let the branch realities in their jurisdiction influence us, and let the federal messaging influence us to ensure that we can have momentum for the profession. We've witnessed a feeling about how decision makers are starting to understand the profession a little bit better, and we don't want to lose that momentum with outgoing government. We really want to continue to demonstrate tangible benefit of utilizing physiotherapists. So here we have some examples of wins of what advocacy has done over the last few years. The Canada Student Financial Assistance Program, which we talk about a lot, was in budget 2025, ensuring that physiotherapists can access student loan forgiveness for working in the North. We've recently been invited to Senate. We spoke with the Finance Committee. We've had several scope wins across the country as a result of really strong branch advocacy. So there's a ton of reasons and a ton of evidence that mobilizing together is working. And that involves you guys and making sure that members and non-members and physiotherapists across the country feel inspired to participate in advocacy.
Chrissy, can I just jump in for a quick sec?
Yeah, of course.
I just want to add on to that. I think it's so important when we think of mobilizing is there's some big pictures of us with health ministers and key leaders in the political landscape. I think the one thing I've learned through being a part of our advocacy efforts, never underestimate a meeting. You could go into a meeting and it may not be with person who is the high ranking decision maker, but they can have strong influence. So that is, I want all of us on this call to take away, you don't need to be talking with the minister. Every conversation and even the smallest conversations can influence a decision. So just keep that in mind as we move forward with this.
Yeah, and I'm going to build off that, Allison. You know, several of our partners on the call were at a meeting that the CPA hosted in November, and we were all very uncomfortable by how often another profession was mentioned by the MP that joined us. And they kept talking about how great this other health professional was. And we were like, yeah, but we're physiotherapists. So this is wonderful, but like not totally relevant. We got the National Seniors Council over the line in that meeting, a meeting that I think Allison, Kayla, and I walked into going, he doesn't even know who we are. They did not brief him very well. Oh my goodness. And we saw a policy change happen out of that meeting. And so, you know, thank you to everyone who didn't emotionally react when that MP addressed us in maybe a way that wasn't a way that we were comfortable, because she's right. Meetings, all the meetings, every little thing, every little conversation, they really influence people. Whether you're a member in a province that gets a phone call from a representative, or a member who comes with us on the Hill like Arthur has, doing pain advocacy, all of those things, it's really a snowball effect in terms of making an impact on how the profession is viewed from decision makers. So far, our consistent messaging to government has been physiotherapy professionals improve the health and well-being of Canadians, like point blank, that is true. Physiotherapy professionals offer cost-effective healthcare options for Canadians. Again, demonstrably true, and we've also authored a paper with Deloitte to prove that to them. Physios play an integral role across the healthcare system in caring for patients in primary care organizations, home care, acute care, emergency rooms, rehabilitation centers, private clinics, community workplaces, educational institutions, research organizations. We hope we don't leave anybody out. We're everywhere. We're prevalent all over the community, and not very many professions can say that. And physiotherapy professionals offer patients reduced pain, faster recovery times, fewer lost days of work, and we reduce the demand for other healthcare system resources and reduce the burden on caregivers. These things are pieces that decision makers need to hear, because we're all sick of hearing about the physician shortage or the impact of nursing problems or all of those pieces. There are more of us in the system than that, and we can provide solutions. We are experts at providing solutions relevant to our competencies. So right now, what we've really been mobilizing around is this untapped potential of physiotherapy. We really want candidates to read our materials and understand the value proposition provided by physiotherapists. We have a tremendous amount of untapped expertise that can serve Canadians and improve the healthcare experience. And so we have been mobilizing against these core messages to ensure that government decision makers are thinking of physiotherapy as a solution. We're going to release this sooner than later, but we recently did a study of Canadians, and Jordan's on here. I know he emails me as soon as I release a Canadian study on what Canadians think of physiotherapy. But 81% of Canadians identified that they have a great deal of trust in the expertise of physiotherapy professionals. It was very clear from the survey. In the same survey, they identified 78% of Canadians trusted the expertise of physicians. And the physicians know this. We share this data with the Canadian Medical Association. We share this data interprofessionally to say, look, we are a sought after and critical part of what Canadians want and what patients want as part of their healthcare team. So there's this opportunity in this election to keep this momentum going and to mobilize the voices of physiotherapists across the country. Which brings us to this election. and all of the wonderful chances that you guys have to engage with candidates. Over the next few weeks and months, consider using our key messages to support your own personal experiences and stories when speaking to candidates and advocating for our profession more broadly. Our messages are designed to help you articulate the priorities that matter most to your peers from coast to coast, because we crowdsource our priorities and we really make sure that they're representative and relevant. And in an election as close as this campaign is shaping up to be, every vote and every voice is going to count in terms of setting priority for the next government. So we've developed the campaign messages to make your advocacy work easier. We want it to be really easy for you to get a meeting with an MP, or to get a conversation with a candidate, or to send a letter or post something or tell your friends about why voting for candidates who are pro physiotherapy is really important. We need our profession to advocate for change so that health policy better reflects both the needs of our patients and the way that we work in the Canadian healthcare system. So we'll just move in quickly to our approach. Our focus is very nonpartisan. And what we're looking to share with all of the parties is that Canada's next government must invest in physiotherapy to improve healthcare for all. At a time when governments at all levels are looking for cost savings and efficiencies, new solutions to improve patient journeys while reducing the socioeconomic costs of illness and injury are absolutely required. There is no better time to improve the integration of physiotherapy expertise into Canada's health system, because Canadians deserve accessible, affordable, and high-quality care. And so the overarching message is that physiotherapy professionals are highly skilled primary care providers who help save Canada's healthcare system billions of dollars every year. And that by expanding our role through scope of practice reforms, better integration into primary care teams, and the support of health human resource focused task force where there's a physiotherapy presence, we can ensure all Canadians from infancy to senior years benefit from a modernized, cost-effective healthcare system. So we really encourage you to consider using these messages as you engage with candidates in your ridings. We are advocating for the following changes this election season. First, we're looking for a national standardized scope of practice to provide Canadians with barrier-free, equitable access to necessary physiotherapy care, including uniform diagnostic testing in all provinces. I cannot shout out the branches enough on this topic. There has been amazing momentum on this file. We see Ontario posting about Bill 179 quite regularly. We've seen reform in Nova Scotia, in PEI. There's so much momentum around this piece, and we want to continue that momentum at the federal level. We need to address the health human resource crisis by prioritizing express entry draws for physiotherapy professionals, supporting bridging programs, and advocating to expand provincial fast-track credential recognition pilots nationwide. In a recent survey, 81% of Canadians shared that they have a great deal of trust in physiotherapy professionals, and 84% believe that physiotherapy professionals are critical to improving Canadian health. So we need to do more to offer Canadians better access to this type of care. And to better serve Canadians, we are calling on the Government of Canada to play a role in modernizing the healthcare system, including eliminating barriers. The final one is establishing a health human resource task force to identify barriers limiting access to care and implement solutions with a clear understanding of the challenges and available resources led by the expertise of all regulated healthcare providers through an interdisciplinary approach, including physiotherapy professionals. We are strong-arming our way into any table that will have us. We have been at Health Workforce Canada meetings. I've been building a relationship with the staff on that team. We are sitting at tables related to health workforce, but we need to stop having to strong-arm our way into conversations. We need the government to recognize the importance of having physiotherapists at the table at the beginning, and stop creating tables that only have physicians and nurses and long-term care centers centers present and make sure that it's more representative of the entire healthcare system. I'll slide through this next part really quickly. The campaign materials are available for you. We have the goal of really helping you mobilize, making this accessible, allowing you to go out, understand what we're saying nationally, understanding what priorities exist across the country, and then use these to share your own opinions with the candidates that you speak, or your own experiences with the candidates that you speak to. Our campaign kit is really your go-to resource for engaging with political leaders. You can use the candidate information, or use them at candidate information sessions, town halls. You can ask questions. You can share our social campaign materials. You can find out about political party platforms and use that to inform your own vote. So really encouraging you guys to take a dive into our campaign kit, especially if you just go to the next slide. There's some really beautiful graphics that we can really get the profession mobilized around. Please tag us. We want to amplify your content. So really dig into this kit, share with us feedback, questions, concerns about the kit, how it's working, because it's really intended to give you an opportunity to participate in political advocacy in your own region. The candidate questionnaire, because we did have some questions about this just when it released. This helps understand where a candidate stands on issues important to physio. So we'll be using this ourselves with candidates, but also it's a good opportunity for you to understand better the candidates in your riding. That is the bulk of it from me. I really just wanted to share with you kind of where our message is, where it's been maturing. And I really want to take a second and give Iris and Emma an opportunity from our National Student Assembly. We've been really proud of the leadership that they've been providing to the organization. And we really want the voice of students to be present. So I'm going to just pass over to you guys and anything that you'd like to add to this before we open the floor. Emma, do you want to go first?
Sure. Hi, everyone. My name is Emma. I'm a first-year physical therapy student at Western University, and I've been lucky enough to act as secretary for the National Student Assembly this year. I'm extremely grateful for the opportunity to learn more about the CPA itself, as well as our role as students in contributing to and shaping the profession. And I just want to express how thankful I am to be included in this webinar. As a first-year student, our thoughts are often absorbed in our studies, and we're not necessarily thinking ahead to joining the profession and what that might look like. But I'm appreciating more and more how important it is to become aware early on and to seek to understand what advocacy looks like. I'm not, or I don't claim to be the most knowledgeable on politics, but I am excited to learn and share with as many of my peers as possible how important our voice is and how to support each other as well as individuals in our communities to vote. Thank you.
Thanks, Emma. And Iris?
Hello, my name is Iris, and I'm a second-year student at the University of Toronto in my master's program. So I've been very fortunate to serve as the president of the National Student Assembly this year and had the lovely opportunity to work with many individuals like Chrissy or like Kayla and like Emma and other students. And I really appreciate all the work that's being done to kind of include us as students in this very important dialogue. I'm also not the most knowledgeable about politics. To me, this is kind of a field I haven't really thought too much about before even entering the Masters of Physio program. But I think that as students, we have a lot of power within our communities, and I'm super excited to learn more about how we can do more as advocates.
Thanks, Iris. It's funny because I was a second-year student who didn't care about anything except politics. So just different strokes for different folks, I guess. But we're so glad to have you guys here. And I think a lot of how Iris and Emma are feeling like, hey, I'm not super political. That's okay. You don't have to be super political to be engaged in politics and to help your candidate understand who they're representing when they get elected, and why it's important that your voice is elevated at the federal level. So don't be shy. I'm sure there's other people on the webinar also who are like, hey, I'm not super political, I just want to learn more. The kit is really intended to give you that opportunity to, even if you don't understand it, the nerds like Kayla and I will take that away. We'll help you understand it. Come with us on a journey, because it's really important for you to have an opportunity to share with candidates. They want to know who they represent, and they do represent us. And there's a big role we can play in changing the healthcare system. So we're so excited that you guys are both here. Bill, Allison, do you want to?
Yeah, I just wanted to echo what you just said there, Chrissy. I think it's so exciting and important that both of you are here and just interested in being a part of the conversation. And yeah, I would echo, you don't have to be an expert in politics. You're an expert in being a physiotherapy student and a future professional, a part of our profession. And that's the message that our politicians need to hear. So you don't need to be that expert. That's right. The nerds like Chrissy and Kayla and me can help you with that information. You just go out there and you talk about what you know, and that's really what's going to get the ear of the politicians.
Amazing. Yeah, if anything, they are sick of hearing from Kayla and I, and they want to hear from you guys. So that's why Kayla and I don't go to advocacy meetings without a physiotherapist. Part of that is because you guys should represent yourself. That's a very important role of the association, is to elevate physiotherapists. And also because they shouldn't talk to us. They should talk to you guys. They want to hear from you guys. They want to hear from their constituents. They want to hear from the people in the healthcare system. So the last piece is just, where do I find the kit? If you haven't found it already, you can literally just go to our homepage and it's there. I'm sure Lisa's about to pop it into the chat. If I know anything about Lisa, you can follow us on social. You can email Kayla. You can email me. You can email Allison at president@physiotherapy.ca. We really want to hear from you, and we love this topic. So we are going to stop now, and we're going to open the floor to questions and all of those pieces. And Kayla can maybe stop sharing her screen, and we will kind of get into it. I will say, politics is emotional right now. Politics is always pretty emotional, but it's in particular pretty emotional right now. We are hosting a professional forum, so just bear with us, and we'll try to keep our conduct and our opinions professional, and I'm sure we'll be fine. But I just wanted to start with that. I know that, especially with talks of annexing and all of these kind of things, it can be quite heated right now. And so we're here to help you navigate a nonpartisan discussion on why physiotherapy is important for policymakers. You have lots of places you can be political, town halls and with your candidates for sure. All right. We are going to point you to the question and answer function if you have questions, just so that we can manage making sure that we responded to everyone. But I did see one. So I'm going to start with Amanda's question. Hi, Amanda. It's really nice to see you. Just question about, is CPA looking to promote national licensure to help? I'm assuming that's with interprovincial mobility, and breaking down interprovincial barriers related to scope. Yes. Okay. She confirmed I understood that question right. Allison, do you want to jump in, or?
Yeah, I guess I can start. And I mean, please, Chrissy, jump in. Amanda, yes, agreed. Nice to see you. Happy to see can't see your face, but happy to see your name. I would say not specifically are we focusing on national licensure. It's really about a focus of how do we elevate the provinces so that we have consistency across the country. Yeah, the specific national messaging isn't on the radar at this point. But who knows what's going to come forward after that. Anything you'd add on that, Chrissy?
Yeah, I think it's important to know that national licensure is a really big focus interprofessionally, especially at the physician level. This is a dialogue they're really championing. And we do believe that interprovincial mobilization is really important for the system, and breaking down any barrier that exists for a healthcare professional to practice where they want, and how they want, so that we're encouraging them to retain and stay in the system, is very important. We think there are pretty innovative ways to do that. Some some of that is called national licensure. Some of that looks like national licensure, but maybe isn't. So I think there's a lot in that dialogue right now, but where we've been really focused with Health Canada is, okay, if you create national licensure for physicians and a physician travels from Alberta to BC and they can't practice at the same level of scope, or hey, all of a sudden, every time they interact with a physiotherapist in a different jurisdiction, it's completely different. That is a inhibiting to the healthcare system. And it honestly adds burden to the physician who has to understand how to utilize the professionals around them. So we're really focused on the scope messaging, and we're really proud of the relationship that the branches have had in that dialogue. But agree with Allison, we're not explicitly saying national licensure, although we're supportive of the work that the physicians are doing to break down barriers to practice.
All right.
We
Who's going to go?
Yeah.
I'll maybe start chiming in on Juliana's question in
Sure.
the Q&A. Thanks so much, Juliana. You know, I think it is so important to whatever you feel comfortable in sharing your messaging, I think is going to be, from my perspective, most impactful. So if you have a specific area of focus that we can link that to the larger messages, I think that is going to create the most impact. So make it what's important to you, because then that conversation is going to flow and you're going to feel a little bit more comfortable in those conversations. So I think if you can start out a bit more broad and then bring it down to your practice area, I think that's amazing.
Great.
Chrissy?
I have nothing to add to that. That was great.
There you go. Well, thanks.
Anthony, I see in the chat, congratulations again on your recent award with the Ontario Physiotherapy Association. I am just going to echo his comments, which is get involved. Your participation shapes the future policy. So absolutely get involved. Derek, it's nice to see you as well. Do you have a general sense of where each party stands on physiotherapy's role in our evolving healthcare system? I can answer this one.
Thank you.
Allison. So we do have a pretty good sense. We have pretty strong relationships with all of the parties. What I would say is that the Liberal government right now, the current sitting Liberal government, is having really interesting conversations about expansion of universal access to care. And I think there is a lot of momentum in the Liberal government for cost effectiveness, which is Mark Carney's whole platform right now, is the economic role that he plays from a more centrist position. And he's looking for cost effective solutions. So I think physiotherapy fits really well in what could be a Liberal government. Conservative government, I think we get nervous about healthcare, and rightfully so, but this conservative government is putting really innovative ideas on the table about healthcare. In particular, one we're hearing from the conservative government federally right now is the idea of a blue seal trade. So a red seal trade, being your electrician or your plumber, can cross boundaries and navigate the system as licensed professionals quite regularly, or without any barriers. And the conservatives have coined the same mobility for health professionals as a blue seal trade. So how do we create a red seal trades for healthcare? And that is, again, to address shortages and ensure that the profession is well represented across the country. So really do see more actual dialogue about healthcare in the conservative space than we would typically see. But really, all of the parties, right, and the NDP, of course, I think there's two parties vying for leadership right now, but the NDP are extremely pro-healthcare. They want a vast move towards universal healthcare. You can see that in the coalition agreements that they had with the Liberals at the end of the last term, where pharmacare and dental care got over the line as a part of those negotiations. So all three parties really representing healthcare well, and I think physiotherapy could be very well positioned in all three leaderships. Should we continue to Catherine?
Yes, absolutely. Awesome. Great questions, Catherine. And I like your follow-up question to our students. Yeah, so I think we've been doing a lot of work around the data and the numbers, and particularly, so Chrissy mentioned the Deloitte report, which shows great economic data about the benefit of physiotherapy. but I think I can speak openly that one of our bigger challenges as a profession is our health human resource data, and how do we get a strong picture about what does that look like from a current state. We do know, compared to other countries, the number of physiotherapists per population is quite low, so we absolutely know there's room for growth. And I think your question is really intriguing. How do we make the case of those that have access and have private insurance? How do we put that into using that in our messaging? So unless Chrissy says otherwise, I would say I think Catherine has been sitting in on some of our strategic planning conversations, because this is exactly the conversation that we're having as a board, to say we need to better understand this and have better data information around our health human resources so that we can have a stronger stance of messaging on some of those pieces.
In addition, we're working quite actively with interprofessional advocacy. So while we're asking you to get involved in federal advocacy based on an election, we have a role to play that is much broader in advocacy, and that is sharing interprofessionally the important role that physiotherapists play. So an example, when you talk about physician shortage and the number of the shortage of doctors and all of those pieces, there are places where physiotherapists, an injection of a physiotherapist can reduce the requirement for a physician to be utilized. We talk a lot, there's ongoing research, and Francois, I know for sure, is doing some, and Jordan around team primary care, around when you utilize a physiotherapist in an emergency room setting, they can see MSK issues without the intervention of a physician at any point in that interaction. They can diagnose, they can treat, and they can send that patient on their way. And that is directly reducing the requirement for a physician, the drain, the gap for physicians. So we've been really working with our research community across the country, the universities, in understanding examples just like that one and sharing them not only with government, but with interprofessional providers who may go, hey, you're getting in our sandbox. No, look, we're here to help you. Because it's okay to say, if somebody comes in with an MSK issue, it is important that they see an MSK expert, and that is okay. It's okay to say that to a physician. It's better if they see me. It's my job for them to see me. I'm not invalidating your role as a physician or invalidating your education. I am just telling you that my competencies, my scope are better intended for treating this patient. And so let's make that happen without requiring them to step through the wheel of going to a physician first. We see this a little bit when we talk about, and we're seeing more and more, the reduction in requiring a doctor's referral to physiotherapists, thank heavens. But one example of this around diagnostic imaging is, we use this example with government a lot. Somebody falls and they hurt their leg, and they go to their doctor and they say, I've hurt my leg. And they say, okay, go see a physiotherapist. And the physiotherapist says, you have hurt your leg, but you need to order an x-ray. So you've got to go back to your GP so your GP can order you an x-ray. And your GP orders you an x-ray and you didn't break your leg. But you've got to go back to your physiotherapist so they can treat your sore leg. And the physiotherapist gets you back and says, oh, but there's an issue here and you need to see an orthopedic surgeon. But I can't refer you to an orthopedic specialist. You have to go back to your GP and ask for that referral. Oh my goodness, we're draining resources from the GP for absolutely no reason, because the entire interaction could have been managed by the physiotherapist to begin with. So we have a real bank of examples, and we're constantly elevating places, and you can see government go, yeah, that's happened to me. I hurt my arm, or I hurt this. And if it wasn't for my extended health benefits, and knowing that I could go to a physiotherapy clinic, I might have went and waited for a few weeks to see a GP or end up in the emergency room. So very much, Catherine, we are elevating as many examples and defining as many as examples as possible, not only in the physician space, but nurses, all of these people who are interacting in the healthcare system, where a primary or a first touch physiotherapist could deal with things and take things off, pressure off of the system. Sorry, Allison, I get passionate about that one.
I know you do. I love it. I think there's some really good comments in there. Dorian, yeah, on the interprofessional barriers, breaking them down, absolutely, 100%. It's not just healthcare, it's so many pieces. Yeah, and Catherine, your comment about the unified, you're absolutely right. And I mean, I think you're definitely preaching to the choir here. We're only stronger the more voices that we have sharing the same messages. And that also helps with our data. The more members we have, the more we can get cohesive data to help make those messages. So absolutely, and would encourage all students to be members and to continue on being members, because yes, sometimes you end up in seats like this a couple of years down the road that you never thought you would, but here you go. Yeah, just some really great more comments about how amazing our profession is. Thank you so much, Anonymous. Beautiful. I love it. All right, looking at Catherine's next question. Yeah, you know, that's a great question, I think, Catherine. And again, I'm pretty sure you were in our strategic planning sessions. We've talked about this back and forth quite a bit. Number one, public campaigns are extremely costly. And I don't know if we've been convinced that it gives us a benefit that we think it does necessarily from the cost investment. And part of how we're trying to change that conversation is say, do we need to educate or do we need to inform the public what they need and when they need it? So really just sharing that message to say, this is when you need a physio and you need to access it in these cases. So I guess it's a little bit back to your question, but it's about how we phrase it and approach it in a different way. It's not on the radar at the moment. Chrissy, there is some things in the work, but I don't want to share anything I'm not allowed to.
No, I think we are getting more bang for our buck going direct to decision maker right now. There's so much more low-hanging fruit in terms of convincing the decision makers than there is in mobilizing the public. Because when we talk to the public already have a very positive experience with physiotherapists. We haven't mobilized the public yet. I think that could be a strategy down the line, but this is our first time asking you to mobilize. So I think we're getting to a place where we're taking the steps that are required to mobilizing public to say, I want to see a physiotherapist. But we need to kind of navigate the system step by step and make sure that we're building and we're ready to take on something as substantial as a public engagement campaign, and utilizing our resources as much as possible. Allison, one piece of feedback: people can't see the questions when you're responding to them. So if you could just read the question when you're responding, that would be helpful.
Yes,
I'm going to jump into the next one for Alec. How do we justify increasing the utilization of physiotherapy in areas where other professionals may cost less? As in cardiopulmonary rehabilitation, kinesiologists are often seen as a cheaper alternative. How do we get out of the paradigm that physio is only MSK? What about neuro and cardiopulmonary rehab? What is the messaging in reducing long-term care in other populations that aren't MSK? Really amazing question, Alec. We work a lot with our division leadership to help us elevate messages around things like physiotherapy in an oncology setting, or pediatrics, or cardiopulmonary rehabilitation, as you mentioned, and really demonstrate we don't only use MSK examples. I'm noting that I did pull 2 MSK examples in so far, but we don't only use MSK examples, and we also don't only use MSK physiotherapists when we're bringing people to government. So it's really important, if you represent a smaller slice of the profession that isn't MSK, that you mobilize and make sure that your presence is known and that the candidates understand that there are people out there who have important roles. Navigating the cost effectiveness of other professions, because we're using that argument ourselves, right? We're saying, hey, we're a cheaper alternative than a GP, and we probably should have some of these patients anyway, so you should use us. The same conversation can be had about, there's a perception that the same conversation could be had with others. There aren't enough physiotherapists. We know that. In order for us to meet the demand for physiotherapy, we're going to need to engage in other professions. If we keep pushing at the top of scope and going, let us do these things, something has to fall out the bottom. And I think you're right that there is a risk in the profession of understanding that other professions may be engaged in that. And what, from our perspective at the association, we really welcome open dialogue with the entirety of the physiotherapy profession, whether it's physiotherapy assistants, physiotherapy technologists, one sits on our board, making sure that we understand how we can leverage physiotherapy as a solution and position physiotherapy as a solution. Kinesiology is an interesting one because they're not regulated in some provinces and they are in others. And so the position or perception of a physiotherapist, of a kinesiologist and their work varies greatly depending where they live. So we are very aware and mobilize our positions about the spectrum of physiotherapy, including assistants and technologists, and understanding that they become an important part of solving for the gap. We're not graduating enough students. We don't have enough seats to graduate enough students to meet the demand for physiotherapy, and we're potentially incurring more utilization demand for physiotherapy. So we have been balancing how we support the profession of physiotherapy without jeopardizing the dialogue around cost. All right, I'll pass it to you. I'm going to note that we are at 7:53. I can see there's lots of questions coming in. We're going to do our best to get through all of the questions that are in the chat right now. I think there's a couple more. And then if we see others come in, we're going to do our best. We'll maybe go a few minutes long, but I just want to respect everybody's time. And we'd love and welcome any dialogue to come back to the CPA, and we can get in touch with you.
Awesome. Thanks, Chrissy. I just wanted to add on to the kinesiology, and no disrespect to kinesiologists. I've worked with many great kinesiologists. I think when I have those discussions, it's also about getting your bang for your buck. From the cost difference you get of paying a physiotherapist versus a kinesiologist, the breadth of scope and different pieces that a physio can provide versus a kinesiologist really outweighs that cost difference. So it's also just making sure we're elevating what physios can do within their scope of practice that is above and beyond what kinesiologists are able to do. All right, I think there's a great question in there about how do you respond if someone says that's a provincial matter? It's a fantastic question, and it's a question we get asked often. And I think for sure the current federal government, and I feel like that's going to continue on in the next federal government, there is an appetite to look at holding provinces responsible for how they're utilizing healthcare dollars. That's already started. There's been the Canada Health Act interpretation letter that's begun. And so I think that conversation is changing. So and Kayla and Chrissy jump in, but really it's about how do we help hold the provinces accountable for that healthcare spending? It's about how do we be innovative and set some of those guardrails so that we say, if this is a principle that we think all Canadians should have access to, then something should be built in any of those policies to say that the provinces must utilize the funding for X. And that would be investing in physiotherapy services. So it's really making sure we call that out at a federal level. So when that money is transferred to the provinces, they have to utilize those funds in certain ways.
Yeah, and the bilateral agreements were unprecedented amount of cash flow from the federal government to the provinces. We're really fortunate. We have great relationships with our branches, who we have a pretty good eye on what's happening provincially. And we get redirected all the time where they say, don't put that message in. That's not going to land in my jurisdiction, or that's not reflective of what's happening on the ground. And thank God I can see many of you here, the important role that our branches play in informing us on where the line is between provincial and federal jurisdiction. With that said, I think there's an opportunity for us. There's a momentum within the healthcare space, not just in physiotherapy, for people to say, okay, you can't say, here's an unprecedented amount of money, and then not tell us how to spend it, or not give us some indication of how to spend it. An example of this is the diabetes device fund that the current Liberal government has. And we've been advocating for, make sure that includes the prescription of orthotics by physiotherapy professionals covered in the diabetes device fund. And Kayla will correct me if I got any of that wrong. Okay, so sometimes I slip on the names. So that's an example where we can say, you guys have just created a fund, a federal fund that is going to be administered provincially. Please make sure in the guidelines of your federal fund that you include physiotherapists' prescription of orthotics and their time in that fund. Or let's include more time with a physiotherapist to manage diabetes and the symptoms of treatment of diabetes. So that's a way that we can balance it. The federal government does have a role to play. Your MP has a role to play in knowing how you are receiving healthcare and influencing how you are receiving healthcare, even if it's not their money or their decision. So I think you're probably not gonna hear that from a candidate. You might hear that from a sitting government, but really helping them understand why you believe it's a national issue and how it's a part of the national dialogue. I think candidates will be very open to that. All right. As someone who cares deeply about Indigenous issues, I think it's important that we also promote physiotherapy as a means of improving access to care for Indigenous communities. In Ontario, we have large Indigenous populations that would absolutely benefit from an enhanced scope of practice. Many of the communities have physiotherapy clinics nearby, and expanding our scope would allow us to serve them more effectively and in a more timely manner. I've seen how much the Deputy Minister of Health, Deborah Richardson in Ontario, cares about Indigenous health. This is something that aligns with those priorities and should be brought forward as a key benefit of moving scope forward. Absolutely agree. And we were so proud of the Canada Student Loan Forgiveness win, because we want to help communities in underserved populations that are represented by those communities that you're eligible for that student loan forgiveness. So that was a big win for us. We've also been quite open in our dialogue with the government about the importance, and please share that with candidates, the importance of getting the HIB right. It's not right now. It's not working right now. Fixing that so that it's actually serving Canadians within jurisdiction and people can access it is really critically important. Share your experience, share the care that you're able to provide to Indigenous communities. I would really encourage you to mobilize that sentiment with candidates.
Well, Chrissy, we're at 5:59.
We are. So what I'll do, there are tons of other wonderful questions, and we are out of time. So what we will do is we will take note of these questions and we will write answers to some of these questions, and we'll post a post-webinar document in the next. Give us a few days on that one. We'll post the webinar right away. So all of you who aren't watching this live, hello. And what we'll do is, in addition to posting the webinar, we'll take some of these additional questions that are in the chat and we'll get you guys some answers in the next week or so. Please, please, please engage your candidates and demonstrate the incredible, competent physiotherapy professionals that you are, and the care and empathy and impact that I know that you can have on Canadians and patients. And really, if I could impart one thing onto physiotherapy professionals across this country, is it's okay to tell people how good you are at your job. That is what, if you take anything away from this webinar, go out there and tell people how good you are at your job. Canadians need to know it. Policymakers need to know it. And they need to start making decisions that reflect the competency of our profession. So get out there and give them some help.
Amazing. I do have closing comments, but I think after Chrissy's mic drop, I think there's no better way to end the webinar other than to truly reiterate everything and say ditto to everything Chrissy just said, and truly thank you all. I know it's hard to give up an hour of your evening to join us, but I see lots of comments in here saying thank you. You feel more supported. You feel more confident going into have these conversations, and that's exactly what we were trying to achieve here today. As Kayla said in our pre-meeting, we want to help make this accessible, make politics accessible for our profession, and we need to not be humble anymore. We need to be able to get out there and say how amazing we are and how we can help the system and help our population. So don't be afraid to get out there. Thank you guys so much. Appreciate all your time. Take care, and we'll talk again soon. Bye-bye, everyone.